Perceive, process, perform. Do you need inspiration for your practice? Or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration. Dr. Ariel Raigrodski is a diplomat of the American Board of Prosthodontics, a professor in the Department of Restorative Dentistry, and an adjunct professor in the Department of Material Sciences and Engineering at the University of Washington. His research focuses on all ceramics, implants, and CADCAM technology. He lectures extensively around the globe and maintains a private practice in Kenmore, Washington. In this short presentation, he provides an update on the use of CADCAM in all ceramic restorations.
So welcome to part 3 of our presentation, and in this segment we're going to discuss concepts of restoration design and how they're affected and managed via CADCAM technology with all ceramic materials. And certainly when we think CADCAM technology, we think about efficiency. And to me, when I think of efficiency, it really translates to A, speed, second, cost effectiveness, and of course, higher quality of patient care. And to me, I'm trying to get all those components together to ensure that we truly provide a better experience for our patients in the long run. And certainly, as CAD/CAM technology evolves, and it's truly an evolution, we have the opportunity to harness the new developments with CAD/CAM technology and marry them with the new materials that we have. And so today, as we look at CAD/CAM technology, we have the option to enhance the design of our restorations in the context of coping design for a crown or a framework for a bridge, and also for monolithic restorations. Of course, let's not forget implant-supported restorations, custom abutments, screw-retained restorations, which are not part of this section. And of course, the combination of that with the newest ceramic materials such as lithium disilicate and zirconia for both bilayered and monolithic restorations gives us, as restorative dentists, a myriad of opportunities which we really did not have in the past. So if you look at this framework, and I'm sure that you have seen frameworks such as that in your offices, we would love to have some more ceramic coping materials, in this case zirconia, to support the veneering layered porcelain at the marginal ridge area to avoid situations such as what I experienced here on that second molar, a fracture of the porcelain at the marginal ridge. With that said, we know that this is been an old concept which we used for years for metal ceramic restorations, and addressing that lingual or palatal collar and the interproximal collar will facilitate the durability and longevity of such restorations. So if we look at this patient here, this patient has 2 failing metal ceramic crowns. These are 2 simple centrals. This is what we see on a daily basis in your offices. And this patient, as we remove those crowns, you can see that we have a discolored abutment and another abutment that is not as discolored. We're going to redo one of the endodontic treatments because of symptoms that the patient has. And this is how the patient looks when the preparations have been refined after the endodontic therapy has been completed and a new post and core has been placed. And now, as we design the 2 crowns, the design is going to be affected by the technology that we have. So we move forward and we place our provisionals, and to me, the provisionals that we're using are going to be a key for the design and fabrication of the definitive restoration. The provisionals give us not only aesthetic information for the design of the restoration, but also, if you look at the palatal aspects of the provisionals, the functional aspect of that restoration. And so all those items have to be evaluated and discussed carefully, and eventually, once everything has been designed to the ultimate, translated to the definitive restoration. And what you see here is the work of the technician designing the copings. In this case, this is Harold Heindel, technician from Mill Creek, Washington. And you can see that he designed a full contour restoration, made a silicone matrix, and then cut back on the incisal and palatal surfaces to allow for accommodation of veneering porcelain on that incisal and facial surface to enhance aesthetics. On the palatal aspect, we're going to leave a full contour surface of monolithic, in this case, lithium disilicate, such as Emax, to allow for better durability in terms of function. And you can see that these restorations, the palatal aspect of those definitive restorations on your left-hand side, are very similar to the contours on the wax-up. Here are the definitive restorations. The translucency is achieved mainly with layering porcelain at the facial and incisal edges, whereas the functional aspect on the palatal aspect of those restorations is made of lithium disilicate, which is a material that is more durable than that conventional veneering porcelain. So in this case, we take the advantage of both materials, we take the advantage of the design capabilities, and we marry them together to try and provide not only a more durable restoration, but also a more aesthetic one in that anterior segment. So this is how it looks once the patient has been treated and the treatment has been completed. Here is another clinical situation, an everyday situation, posterior crowns that have to be replaced, a big amalgam where we're going to do another crown, and those teeth have been prepped. And now we have the opportunity to select and design zirconia copings. And these copings are now designed differently as compared to that zirconia framework I showed you earlier. Now we have that lingual and interproximal color that we're going to use to enhance the support for the veneering porcelain, and hopefully doing that will allow us to provide a better restoration for the patient. And this is important not only with metal ceramics. There's plenty of research to show, both in vitro and clinically, that this is also important for all ceramic restorations, mainly with zirconia. And you can see here on the left-hand side of the screen that the design of the coping on the CAD unit is as such that the coping provides support to that veneering porcelain. So now in 2008, we tried those copings, we delivered the restorations, and a few weeks ago, the patient was seen in the office and everything still looks intact. These restorations were layered with a veneering porcelain for zirconia. In this case, that veneering porcelain was pressed, which provide us with more durability, and these restorations are still doing great. The other option that we have now is monolithic restoration, monolithic zirconia. And the questions that we should ask ourselves when we think of monolithic zirconia are, A, does that mean that we're going to have a monochromatic zirconia? Are we going to have a monochromatic restoration? The second question is the mere fact that we're going to have a monolithic restoration will allow us to be more conservative in terms of tooth reduction? Can you imagine maybe trying and be more conservative in the posterior segment, reduce more tooth structure, maybe similar to what we do with gold crowns, yet provide the patient with a tooth color restoration? The next question should be, what are the wear properties of such material? Would such zirconia wear the opposing dentition? Because if that's the case, then maybe we shouldn't use it. And last but not least, a very important issue. The zirconias that we've seen previously are zirconias that were designed for copings, frameworks, and abutments, and they are strong. Is the new zirconia for monolithic restoration, which is supposed to provide more aesthetics, maybe more translucency, is it weaker? Are we trading in the aesthetic and mechanical properties here. So if you look at that slide, we know that for copings and frameworks, in general, the value of flexural strength ranges between 900 to 1200 megapascals. And this is before aging in the oral environment. We did a study evaluating aging in the oral environment, aging of different brands of zirconias for copings and frameworks. And if you look here, we looked at bars that are 0.2 millimeter in thickness, which is pretty thin. All those brands, when they were subjected to fracture with testing of flexural strength, the initial flexural strength was well above 1100 megapascal, which is within the range of what we've seen in the past. The question is, what happens after aging? And with this model, known as accelerated aging model, according to the ceramic engineering literature, every hour under those conditions of 134 Celsius, 2 bars of pressure in a humid environment is equivalent to at least a year in vivo. So what happened after 200 hours? And the answer is we saw a significant reduction in flexural strength. And we're looking at still over 800 megapascals. So this is very encouraging. So this is for the coping material, the framework material. But the question is, what happens with the new materials? The ones that are designed for monolithic restorations. And we looked at some of them. And the interesting thing is, different brands may react differently to aging. And if you look at that brand, those brands, as you try and fracture them immediately as received, the values are all above 800 megapascals. Some are stronger, maybe 1600 megapascals for per tau. Some are weaker, Katana ML. But the question is, what happens after aging? And what we found was extremely interesting. After 200 hours of aging, with the 2 first ones on the list, they actually became stronger. This is the first time we've seen something like that. And the other 2, after 100 hours of aging, fractured spontaneously. So I'm not saying that those 2 brands are going to fail intraorally. These are extreme conditions. But in general, I want to know what the values are, and maybe I would go with a material that maybe provides higher values over time. And how come those materials became stronger? This is kind of out of what we usually see. And the answer is very interesting. I'm not going to go to all the dental material science behind it, but the point is that those materials, the Katana HT, the Noritake HT, and the Noritake ML, showed lesser changes in terms of their particles after the aging. And such a change, minor change such as that, we call it transformation from tetragonal to monoclinic. A small change such as that actually strengthens the material. Whereas with the other 2 materials, we saw significant transformation, significant change in particles which caused that dramatic reduction in strength. So this is quite encouraging. And if we look at those issues, certainly we know that not all zirconias are the same, and some of them will respond differently in terms of strength. What else? Well, we wanted to look at wear of the opposing dentition. And I looked at the literature, and some materials get the best properties in terms of reduction of wear of the opposing dentitions after their glaze. Others will perform better after the zirconia is polished. And here's another study that was kind of on the fence. I can tell you one thing. I would prefer to use a material that has better wear properties, does not wear the opposing dentition, after I polish it. Because always after cementation, we're going to have to do some minor occlusal adjustment and then polish, and then we're in better shape. What else is important to remember? Well, here's the thing. This is a new study that just came out towards the end of 2014, and that study kind of looked at the first time on how zirconia behaves as compared to PFM, to metal ceramic restorations. So monolithic zirconia exhibited significantly higher fracture loads as compared to lithium disilicate, monolithic lithium disilicate, layered zirconia, and metal ceramic restorations. Also, if you increase the thickness of the material from 0.6 millimeters to 1.5 millimeter, its fracture resistance goes up threefold. And the bottom line, which was really exciting for me as a clinician, was, wow, the fracture resistance of monolithic zirconia crowns with a thickness of 1 millimeter at the occlusal aspect is similar to what we see with PFM. So this is really the first time that a statement such as that is made. And maybe, just maybe, we can consider now zirconia as a substitute in its monolithic design, maybe a substitute to gold. With that said, I'm not saying that that's what we need to do. This is just the beginning. This is where new information is out there, where we can start thinking about those paradigm changes. Of course, gold is a wonderful material, and whenever I can, I would place gold in my patient's mouth. So here's a patient that came to my office. That patient has a full mouth rehab that was done a few years ago. We have some issues from an occlusal standpoint. There are some failures. There are some fractures. That patient never felt comfortable in terms of her bite. And the good thing was, although she was class 2 in her molars, she was still able to get canine guidance. So you can see all the fractures that we have, mainly on the maxillary right side, and those porcelain fractures are an evidence to the fact that the patient was trying to get comfortable occlusally. We gave the patient a deprogrammer, and after a few months, we're able to make diagnostic impressions, mount the cast, the diagnostic cast on the articulator, and create a diagnostic wax-up. Removing the restorations is always a daunting task. We all know that. And then the idea is to go ahead, place the provisional restorations based on the wax-up, and then let the tissue heal. It's all about that soft tissue management from the restorative perspective. This is our challenge as restorative dentists. And those provisional restorations can serve as an excellent tool for managing that soft tissue. So once the tissue is healed enough, we can go ahead, remove the provisional. The patient functioned with those provisional for several months. We want to know that the patient is comfortable, and then we're ready for our final impressions. And we also make impressions of the provisionals. We mount them on the cast, and then serve as a guide from an aesthetic and functional standpoint for the design of the definitive restorations. The casts are cross-mounted with the working cast, and now we design the framework on the computer. So the technicians here, in this case, from CASP, Masaseto and Nori Kajita, you can see here the design of the molars is monolithic. The design on the canines is bilayered, and on the bicuspid, we have what I call a hybrid design. The areas subjected to occlusal load, the areas that are not aesthetically important are monolithic, whereas the facial area that is important in terms of aesthetics is cut back, and we have that framework type of design there to allow for space for the veneering porcelain. So we do our framework trying. This is an opportunity not only to assess the fit, not only to pick up the pontic site, we have an ovate pontic site here, but also to assess occlusion and make some adjustments as needed. And here we go ahead. We have all our copings and frameworks in place, and we do a pickup impression. And this will allow the technician, now as the tissue is not retracted, to design the cervical contours of the restorations in an ideal manner. Here's the definitive restoration. You can see how everything blends with the soft tissue. And here are the radiographs. The patient appeared like that. Here is the patient's smile with the provisionals, the patient's smile with the definitive restorations, and the patient was extremely happy, so she brought me a picture from the earlier days, and she said to me, wow, this is the same smile that I had before. And this is, as you all know, a very gratifying experience for us to listen to a patient such as that. So to just finalize everything that we discussed in terms of restorations design, we can see the monolithic, the hybrid, the bilayered. The advantage of the bilayered is that it gives you the most aesthetic option, yet the disadvantage is that it's less durable. The monolithic restoration is still the most durable, yet we still have some aesthetic limitations. And the hybrid design gives you the best of all worlds, both aesthetics and function where it's needed. With that said, it requires excellent communication with your dental ceramics to allow for getting that ideal design. So you look here how those restorations blend with the soft tissue, and to me, that soft tissue restorative interface is truly the essence of what we do as restorative dentists. If you want to read more about that, this book just came out with Quintessence Publishing about soft tissue management from the restorative perspective, and I'll be happy to share the information from there with you. So thank you very much. If you have any questions, here's my email address. I'll be happy to answer, and I look forward to seeing you in the future. Thank you.